Why did I take time out of my busy schedule to testify to the West Virginia legislature? And why do I think it's important that physicians across the country pay more attention to what's going on in their state houses? Hi, I'm Dr. Bryce. I'm an OBGYN resident and mom of five in West Virginia, and I spent Tuesday afternoon testifying to our West Virginia Senate Health Committee. This year, there is a bill in the Senate Health Committee, like there is every year, kind of further codifying and solidifying or reinforcing our abortion ban here in West Virginia. As a part of that bill, there was a clause that said that all physicians, regardless of specialty, would need to complete 2 hours of CME or continuing medical education every 2 years in order to maintain their license. They had a year within their first year of being licensed in West Virginia to get their initial one. And then every 2 years after that, they would need this continuing medical education or CME. While I testified that abortion is safe and effective, that it's going to harm women, that it's going to harm the ability of West Virginia to recruit physicians, it's really going to harm the ability to get young people, people of childbearing age, to come to West Virginia, because abortion is healthcare. And there are times where, whether we like it or not, that you may want or need an abortion. Regardless of all that, I kind of knew that that testimony was going to fall on deaf ears. They've heard all that before. What I was able to do was point out that requiring physicians who have nothing to do with this care, and even the majority of OBGYNs have nothing to do with abortion care. Some don't counsel at all. The majority, even if they do counsel on abortion as an option, do not prescribe the pills or perform those procedures themselves. A lot of times they will send them to someone who has completed a fellowship or done more training in advanced family planning. And that is perfectly normal and acceptable. It's just kind of the way that it works. And I forget what the statistic is, but it's a pretty low percentage of even OBGYNs who provide this care. So I was able to provide that testimony. I basically bet them, I was like, we are so overworked and so burdened. Please don't give us one more thing to do. And they heard me. Senator Takubo introduced an amendment within the Health Committee and was able to remove that provision of the bill. And that is just one example, one small example of why it is important to pay attention to what is in your legislature. Because whether you agree with the bill or not, there's always some small change that might be able to be made that might make your life better. And if you didn't know that that provision was in the bill, if you weren't paying any attention to what was going on in your state house, you might not know that. And then every 2 years, you might be stuck doing an extra hour, 2 hours of CME, which is not only 2 hours out of your life, which is already busy and hectic and you're already overridden, but it can also be very expensive. And so that is just one example of why I think it is important for physicians to pay more attention to what is going on in their state houses. Do you agree with me? Do you think we should be more involved? What is going on in your state legislature, and what are you going to do about it? Let me know in the comments below.